You would think with about 9,500 physicians licensed by Mississippi that it would be easy to get health care, but access, or the ability, right, or permission to approach, enter, or use is a pretty tricky thing. The U.S. government measures access to health care by counting the number of equivalent full-time primary care physicians in a county. Why? Because they serve as coordinators to more specialized care. They are your medical home. You can't just make an appointment with a cardiologist. You must coordinate with your primary care doctor first, and most insurance companies require that referral in order to pay for the specialized health care. In Mississippi, there are almost 9,500 physicians licensed in the state. Of the 9,500 doctors, only 5,700 are actively practicing in Mississippi. Of the actively practicing, only 2,300 are primary care physicians with Mississippi practice sites. So this means about 40%, or less than half of doctors, are primary care physicians in Mississippi. A number of factors are included in the calculation of doctors, but most important is the number of full-time equivalent primary care physicians in a county. The math is essentially a ratio of doctors to county population. This calculation results in a score that determines if a county is a designated health professionals shortage area. When a county has a high HPSA score, a number of incentives kick in for health professionals to come to that area and practice primary medicine. Incentives include medical school loan repayment, higher salaries, and training grants. Your county's HPSA score determines if these incentives are available to recruit additional healthcare professionals to your area. The problem here is that HPSA math may overstate the access to healthcare in an area. How? By assuming that every single physician is a separate, standalone access point to healthcare, which they are not. Just like any other professional service, doctors operate in a practice with other doctors. Physician practices operate as small businesses, so they're free to either accept or not accept people seeking to be a new patient. Many of these practices decide whether or not they want to accept new patients based on the kind of health insurance the patients have. Let's assume there are 9 primary care physicians in your county. HPSA treats that as 9 different access points. In Mississippi, the average primary care practice is 3 physicians. So in your average county, what's supposed to be 9 access points to healthcare is down to 3 points. In Mississippi, acceptance by health insurance type can range from almost 100% to less than 50%. So in your average county with only 3 access points, only 2 or 1 of those practices may be open for you, depending on the type of health insurance you have. This means when policymakers start talking about increasing access to healthcare, it isn't as simple as getting more doctors in an area. We need more primary care practices in Mississippi, and we need those practices to be open to any kind of health insurance, because primary care is the front line of disease prevention. For more information, visit the Mississippi Center for Health Workforce website at nemsahec.msstate.edu.